Anyhow, thank you all for being here today. To start this session off, I want you all to repeat after me the following. The mouth is part of the body. Yeah, at the first ever Surgeon General's Conference on Oral Health in America, June 2000, that 3-day meeting was opened up with that injunction. Please repeat after me. And we heard that hourly for 3 days. We all got the word that the mouth is part of the body. Anyhow, in 2000, shortly after the Surgeon General's Conference, at the Surgeon General's Conference, I should say, I met Olson Huff. He was referenced this morning as having started a program in North Carolina called Into the Mouths of Babes, wherein he was training physicians, pediatricians, and family medicine physicians how to do caries prevention as part of well child care, applying fluoride varnish to the teeth, educating caregivers about their role in prevention, doing a risk assessment, etc. And over dinner one night, he challenged me to come back to Minnesota and replicate what he was doing in North Carolina. Fortunately, 6 months earlier, Minnesota had convened a dental access task force of about 55 people, convened by DHS. DHS wanted to get a sense of the oral health status of Minnesotans, broadly speaking. So I came back from the meeting Olson Huff, and I called Tom Fields, who is Tom in the room right now or not? He's here today. Tom was in charge of the dental access task force. And it said there were about 55 people on it, and I was the token physician. So I came and called Tom Fields and said, by the way, I've been challenged. Will you pay? I.e., will you pay physicians an extra fee for putting fluoride varnish on? And the answer was an immediate yes. So I got busy rounding up some dollars to develop some educational materials, et cetera. And for the last decade and a half, I've been training physicians how to do caries prevention as part of well child care. About 6 years ago, I had the idea that what I decided I wanted to do, instead of working physician by physician, I wanted to work, more broadly speaking, county by county, if at all possible. And so I took a map of the state of Minnesota and drew 2 vertical and 2 horizontal lines, trying to create 9 districts of roughly equal acreage. And then I looked to see which county in each of those 9 districts had the largest number of Medicaid-eligible children, on the theory that the more Medicaid-eligibles there are, the more cavities one would find. And then I approached the chair of the Board of County Commissioners of each of those 9 counties and asked if he or she wanted his or her county to participate. And each commissioner said the same thing. Absolutely, we know we have a major problem in the counties. Our children have very little, if any, access to dental care. And so I was all set to start going across the state to my 9 counties, and for reasons that I cannot explain, I started with Nobles County, which is in southwestern Minnesota, where the major city, Worthington, is the turkey capital of the world. And I talked to the mayor of Worthington, and he invited me to come down to Nobles County, but he advised me that I couldn't just work with Nobles County, because Nobles County was in the process of thinking about joining 6 contiguous counties in what has become known as the Southwest Health and Human Services Agency. And I thought, okay, just in case they do merge, I might as well work with the 6 others and include Nobles, and if it doesn't happen, so be it. So I started with 7 counties. And at that point, I realized I couldn't handle the other 8 in the state, so I decided to focus just on the southwestern Minnesota at that moment in time. And then I just realized that if I was going to start a new project and get the community oriented, I needed some local vocal advocates. And at first I had the idea, why not use 4-H? Because 4-H is kids are very commonly involved with 4-H here in Minnesota. So I chatted with the lady at the state health department, at the university extension program, who runs 4-H. And she thought it was a great idea to engage the 4-Hers in doing a project on oral health. And then I developed some public service announcements, which they would be able to read over the radio. And I thought everything was going to go swimmingly until I learned that the 4-Hers, albeit that they have to do a project, they have to think of the project. You can't hand them one. And it turns out that if they had no orientation towards oral health, they couldn't very well think of a project. So we're in the process now of trying to educate the 4-Hers enough so that maybe down the line a year or two, they can become vocal advocates. So instead I turned to 3 service organizations. Lions Club, Rotary Club, and Kiwanis Club, all are active in southwestern Minnesota. Lions outnumber the other 2, I think, roughly 3-1, and Dan can correct me if I'm off on that ratio. But all 3 of them stand for children and community. So the thrust of my project now, the Minnesota Oral Health Project, is to get the community stakeholders sufficiently knowledgeable about caries. And caries I'm using as a term for the process, the end result of which you all know is the cavity. If you need to get the community stakeholders sufficiently educated about caries, and that it is an infectious disease, and therefore it is theoretically preventable, and that physicians can do some prevention as part of well child care, et cetera, so that they can then get busy in their own community, or making sure that the physicians truly are educated by me or someone else how to do caries prevention, and given some information that they can then use to educate the caregivers about the etiology of caries and the caregiver's role in prevention, and basically take ownership of the problem in their community. Now, this is what I'm doing in southwestern Minnesota would never play out in Ramsey and Hennepin County. They're too big. You can't get your hands around those counties. But in the smaller counties, when you've got 7,000 people maybe, I think it's where everyone plays together, prays together, and works together. It's pretty hard to get below the radar screen. And at this moment, I'd like to ask, how many of you in this room are from rural, not rural, that's a mistake. It's politically incorrect to use that term. Tony Lurie told me a couple of years ago. Greater Minnesota. How many of you are from Greater Minnesota? Raise your hands, please. Nice and high. Because what I'm hoping before this session is over with, that you can give us some feedback as to whether, from your perspective, coming from County X, Y, or Z, whether we're approaching winning over the county and getting them educated. Are we doing it right, or have we missed something and we're doing it wrong? And if we're doing it wrong, I want to be advised as to how to do it right. Because the hope is that the county takes ownership of the problem. They tell the docs, you do the prevention. And they say to the dentist, and by the way, you're part of this community, so why don't you start taking referrals for restorative work and ask the docs to be your counterpart to do the prevention side, and together you can work collaboratively, and I underline that word broadly, collaboratively in the care of the mouths of the children of this community. That's the thrust of the project. Along the way, as I said, started to educate the Kiwanis, Rotary, and Lion Club members. And initially when I started, the Lions Club of District 5M3, which is down in Nobles County, said to me, you've got 7 counties right now, and our sphere of influence is really 13 counties, so would you mind taking on 6 others? I said, sure, not a problem. And that was on a picnic in a cornfield when that decision was made, right, Dan? Then we formed an alliance with Southwest Initiative Foundation, which also has an oral health initiative going on. And they said, we'd love to work with you, but our sphere of influence covers 21 counties, of which 13 are already yours. So would you mind taking on 8 more? And I said, that's fine. Then at a district meeting of Lions, District 5M1, 2, 3, and 4 met in April in Marshall, Minnesota. And Districts 5M1, 2, and 4 asked for permission and received permission to join District 5M3. Suddenly my working counties morphed to 46. And about a month ago now, the Lions Club meeting as a statewide, all 13 districts, voted unanimously to support the Minnesota Oral Health Project. Now I'm up to 80. Now I'm up to 80 counties, which is Greater Minnesota. So I'm here to giving you the broad brushstrokes of what the project's all about. Dan is going to talk to you a little bit about how he engaged the Lions Clubs and got the vote that we got.
Thank you, Amos. I don't have anything wrong with my voice, and I try to be a gentle soul. I'm a physical therapist. I worked at Southwest State University in Marshall for 37 years with students with disabilities. Our campus is fairly new there, and we have very, very good accessibility, and we have all levels of people with disabilities attending our university. Some of these people have 10, 12 hours of personal care assistance a day, so you can kind of understand. We also have a very good wheelchair basketball team out there too. But why did I get involved in this project? When I was approached by Dr. Deinard out in the cornfield, I was just sitting there eating. As you can see, I'm kind of a portly guy. And Dr. Deinard was on a telephone from his home, I believe. And at that time, I heard his message, and I also knew that in the early 90s, our students, particularly those with disabilities on medical assistance, had come to Marshall, were having dental issues, and our dentists wouldn't take them because they were not accepting medical assistance. And I'm an advocate, and you'll hear as my little spiel goes on here, I might get a little testy, so please forgive me. But, you know, my thing was I'd call up the dentist and I'd just say, hey, I've got a student here. They've said they've been down to your office. They've talked to your front people out front, and they say they will not take this student. I says, this student is about ready to drop out of school and go home. And I said, I think we have a responsibility, as long as they are our guests in our community, and we can reasonably care for them, would you please take care of this student? I usually didn't get a no, so it always occurred. So that's how I was aware of what was going on. A long time ago, I learned that we start with people where they're at. And I guess I look at our whole medical field, and I put all of us in here no matter what area that we're in. If we don't have a holistic approach to people, we are not going to be successful. And I look at some of you folks that are closer to my age, and I know most of you are younger, other than Davis. But this whole thing that's going on in medical care, we have some major paradigm shifts that are occurring. And when I look at rural Minnesota, or greater Minnesota, we have even bigger issues because we are having difficulty in recruiting health professionals to come out. And I'm going to go so far as to say my experience has been the health professionals, the number we have out in their areas, are really good there because they married a farmer. And so part of one of our requirements might be in licensure is that you got to marry a farmer. It could be a lady or a man. It's not, I'm not concerned about this. And I remember when I came to Marshall, 40-some years ago, we were having this problem with not being able to recruit physicians. And we had a Dr. Odlin out there that was a few inches taller than me and about as big. We sat through this meeting with the public health nurses, and they went on and on and on, and finally Dr. Odlin got up and he walked up to the front of the room and he said, you know what our problem is? It isn't getting the guys out here, it's getting their wives out here. And he says, we shouldn't let them get married even if they have to. Turned around and he went and sat down. And so I've kind of switched that around now. We want to recruit health professionals, but maybe we're going to have to get you to marry a farmer to come out there. We know in southwestern Minnesota, in my district of Lyons, that's 5M3, 72% of the dentists are 55 years or older. I heard the number today from the gentleman that spoke early this morning that said that, what was it? The percentage of people in the metro area, was it 74 or 84%? And the rest of the dentists are in greater Minnesota. Boy, our numbers are pretty small. And so when I'm out talking about our problem that we're having with people receiving care, and even those who are people that are medical assistants or managed care, I look around the room and say, folks, it's not too many years, we're all going to be in the same situation. There is not going to be a dentist here to take care of us. And so again, we look at these paradigms and what we need to do. Again, my thing is to advocate, and I think it's time. I've been through, I would say, about 70 meetings since August of a year ago, where I've visited all over with communities, community service organizations. We've had meetings with dentists, physicians, the public health people, WIC, and I have some things that I've heard, and I'd just like to share with you what they are. And Amos started out having you repeat something after him, but at the top of my thing in big bold print, mine's a little different than his, and I want you to repeat after me. The mouth is part of the body, too. Thank you. Amos, you did a very good job in the classroom there. But here are some of the things that I listened from the community stakeholders. And let me give you my definition of community stakeholders. That's everybody in our community and the farms and the folks around them. And one thing I heard, every child should have the opportunity to be safe and healthy. Don't create something new. Work within the current systems to deliver parenting skills. And we have to start with caregivers where we meet them. Engage direct caregivers with preventive education to internalize parenting skills. Encourage caregivers to be empowered to ask about their child's oral health care while they're being seen by a dental or a medical provider. Again, a health home, not different silos. In 2005, the Center for Disease Control declared water fluoridation is one of the top 10 most cost-effective public health measures of the 20th century. Again, 72% of our dentists, this is our dentist reporting this to us, practicing in southwest Minnesota are 55 years or older. The other thing that they said, they have nobody interested in joining them in their practice or purchasing it. So again, I believe every community, probably 3,500 and less, unless your community has a plan put together, I think you're going to have a great difficulty in attracting a dentist. And we've been to the Chamber of Commerce people, and they said, well, we don't want to talk about that. And I sat there just scratching my head saying, why not? Well, that's their problem. And I've said, you got dentists now. Well, what's going to happen when you don't have any? One other thing that would always continue to come up, that the greater Minnesota dentists were being paid less than our metro friends. A Redwin Hosman from the Department of Human Services shared with me on December 20th, 2015, there is no regional discrepancy, taken directly from his memo. Then I know this past year with the legislature, there was some things done, and I contacted him again, and on September 9th, 2015, he put down, Minnesota legislature increased the rate by 9.65% for dental providers located outside the Severn County metro area. The rate increase is effective July 1, 2015 for the members with fee-for-service coverage, and January 1st, 2016 for those covered through managed care organizations. Now, we heard our speaker early this morning, former senator, say it was 5%. But this was the language that I received from Mr. Hosma. Again, in all the discussions, dental reimbursement rates by Medicaid needs to be an open review by all stakeholders. That includes our politicians. And I look at our Minnesota Oral Health Program, and our primary focus is to increase access, increase awareness, develop and provide educational materials for all community stakeholders. Again, as an advocate, I get concerned when it seems like lots of talk, lots of talk, lots of talk. I think we're at the point now on why I went to Lions and Kiwanis and Rotary and any of the other small community service organizations. They're in our communities looking out for our children. All of us have our mission as part of the thing is health and education for children. That's in every one of our mission statements. My thing is, then we need to educate them a little bit more about what's going on. And at the same time, we need, as stakeholders, and those other people in our communities include the caregivers, and that's mom and dad, or if it's a foster home, or if they have other grandparents and somebody looking after the child, we have to come together, and we need to go before the governor and the legislature and say that we need to have this issue addressed. And I think it can be worked out. I believe there is enough safety nets in place that if everybody would step up and do their thing and collaborate and work together, this can be taken care of. Will it be totally perfect? No, but it will be a lot better than what we're doing right now. And so that's what, as a Lion, a past district governor, and again, I presented on October 17th at MNOHP. Dr. Deinard made a reference to that. And after they were done, that they accepted that as a challenge. We have our 100th year of Lions coming up. I have a feeling in the next year or two, this will become one of the major projects of district, multiple district 5M, and we look at it going across the United States, and our multiple district 5M also includes part of Canada. And I saw our Canadian friends get Dr. Deinard on the side, and they spent a lot of time with you discussing some of the issues they were having in Canada too, correct? So, and again, we know there's many underserved populations out there. So with that now, Shruti, I guess I'll give you a little opportunity to follow behind me. She'll be a lot gentler. By the way, when I was a young man, well, she's coming up here, come on up. I remember having this dentist in Walnut Grove. Now, how many people are familiar with where Walnut Grove, Minnesota is? Little house on the prairie, big celebration. I'm a big old tough guy. This dentist there had to be the toughest guy that I'd ever dealt with in my life. And he'd get done with you, and it wasn't only me, it was everybody else that he worked with. But he had this beautiful assistant that came in afterwards and cleaned up everything and made it all right. So, again, that's been my experience out there too. So right now we'll turn it over to you. You want this louder?
I got this one, thank you. Okay. All right, so I actually had no idea I was going to be speaking. I found out when he told you just now that I was supposed to be speaking, so I'm going to just wing it and see where I go. So I've been working with Dr. Deinard for about 1.5 years now. I'm a master's student in public health at the University of Minnesota, and got involved with this project really early on in my career as a student there. So a little bit about what, I'm just going to try to bring everything together, I guess. Dr. Deinard, he spent a lot of time over the years training doctors around Minnesota to do the preventative care aspect of it. But what we realized as he did those trainings was that the doctors often weren't actually putting the whatever he taught them into practice and making that into a regular daily routine for the patients that they see. So we decided to take a different approach, or I guess he thought of this approach to bring in the community leaders, as Dan mentioned, with the Lions Club and the Kiwanis Club, They're really community leaders that we want to take the message to their own doctors about how important it is to take care of their children within their communities. So a little bit about what I guess I've done with this project. I've been involved more with the educational material aspect of it, because right now what it really is education and influence is what we're really looking for and striving towards. So we broke up the two groups that we want to target. Our mothers-to-be is the first group, and then the second group is mothers of children 0 to 5 years of age, because that's really when, you know, oral health needs to start, is right after the eruption of the first tooth, and hopefully even before, so then the practice starts and is actually continued on through the later years. So with mothers-to-be, we really wanted to get to where they usually go for care. It's all about finding where they normally go and then seeing if we can integrate within that entire process. So I've helped create materials, education materials in terms of brochures, and helped a little bit with the PSAs. We're currently trying to contact WIC clinics, OB clinics in these counties, doulas, and another one that I kind of thought of, because I'm a pharmacy technician as well, is pharmacies. Mothers-to-be or expectant mothers usually come into the pharmacies to get breastfeeding machines and stuff, and so usually they talk to the pharmacist before they're allowed to take it out of the store, and so that's a really prime opportunity to start talking about oral health. The mother's already thinking about, you know, how to feed the child, and, you know, the health aspects of that, and so that's a place where we can get into the entire system and educate the mothers on when to do the feeding, how to clean the mouth, and how to take care of their babies' mouths. The other part with the mothers of 0 to 5 years of age, we're trying to contact early childhood and family education programs, and Head Start programs, early Head Start programs, and daycare centers are the other big ones. So we're trying to send them the education material and see if they need help from us to actually understand the education material, to pass it out to the mothers and these children, and get the process started. So that's where we're kind of at right now. And